Hello, everyone, and welcome to this week's episode on Fit as a Fiddle. Our guest today is Dr. Tim Garrison. He is an orthopedic and vestibular physical therapist out in Maryland, and he's here on the show today because we got connected from a family member that ended up seeing him, who found him so lovely and so amazing and helped him so much. So I just thought it would be great to have Dr. Garrison here on the show with us, talking to us about a really fun topic, dry needling. So, Tim, I'm going to let you go ahead and introduce yourself a little bit more and tell us about the work that you do.
Thank you, Dr. Sneha. It's really nice to be here. And yeah, so I'm a physical therapist. I've been practicing in Maryland. I was also licensed in California for a little while. Um, and now I've been practicing for about 19 years, almost 20, I think. And I treat 4 days a week. I treat Monday, Tuesday, Thursday, Friday. I'm a partner with two clinics. One is in Frederick, Maryland, and another one is about 30 minutes south, called Germantown.
Yep.
So we have a nice team in both places, and like you said, so I do orthopedics for a lot of my career. I still love orthopedics. I treat a variety of things there: surgeries, back pain, ankle pain, knee pain. But also for about a decade, I've been doing vestibular care, and I hold multiple certifications in vestibular. And that's kind of how we got into so we're part of a franchise group called Physical or Physical. So it's spelled F-Y-Z-I-C-A-L, which funny, it's funny about the spelling because the first, so my mother said, I told my mother, we joined with this company called Physical, and she's like, oh no, Timmy, you spelled the name wrong. So it's an F instead of a PH. So, but it's spelled different because we are different, and we have really great stuff that it differentiates us on the vestibular and balance care from other clinics. We have like an overhead harness system called the Solo Step, and it's just a great place to learn and grow and treat patients really in the best way that I've ever found to treat patients for balance care, falls, and dizziness. Um, so yeah, I love both of those things, and I also hold certifications in dry needling. My background there's a institute called Myopain Institute in Bethesda, which is like north of DC. If you're not familiar with, it's in Maryland, and they have a wonderful institute there, and they have some of the top trainers. And the guy who started it is named Jan Dummerholt, who's really, he kind of started the field, and he wrote the book on the topic, and he's big in research, and uh, he works with international partners for research. So it's really exciting to be part of that. And yeah, so that keeps me interested, and I still love doing it 4 days a week. uh, so yeah.
That's amazing. I was always interested in Vista, but I never actually went into like treating it a whole ton. I have patients who have like some, things related to vestibular care, but I always refer
Yeah.
out to a vestibular specialist. I'm like, there's a lot more here that I can do that equipment and just stuff that's so helpful and research based. And I don't have all that stuff in my clinic. So I really appreciate the work that that field of PT does because it's just so important. And I think that it often gets missed a little bit here and there, but it's such a big part of our field actually, and so important for people's care. Um, so that's great. I want to start talking about dry needling now. I'll tell you a little background on my experience with dry needling. It's not allowed in the state of New York, which is primarily where I practice. So
Oh
I
no.
haven't been able to do it a whole ton over the last years. I did a clinical in New Zealand where I did it like every day, like it was my job because of the reason that I knew the second I got back to New York, I wasn't going to be able to. So I did it a whole ton, but this was also years ago. Um, if I'm not mistaken, New Jersey now, where I'm also licensed, has reinstated it to some extent. But just because it's been so many years since I've done it and I would have to take coursework again, I have to remind myself how to do it. I haven't done dry needling, nor have I taken a course in it in a long time. So I'm going to use this opportunity to remind myself of a lot of things with you. since you do this a whole ton. So, Tim, let's get started with just, we haven't had this topic at all on the podcast. So a lot of people, when they come to me and they ask about dry needling, they'll be like, what is that, acupuncture? And I'll have to explain to them the differences. I also have a ton of patients who are like, oh, I had my physician, my doctor, my DO, whoever, do like, and put a needle in my jaw or my wherever for some care. Is that what PTs can do too? So I have to sometimes answer these questions of the differences in the way that needles are used in bodies in different professions. So would you please go ahead and talk to us about how dry needling is used specifically in physical therapy setting, and maybe some big differences compared to other settings as well?
Yeah, sure. So first it's called dry needling because there's no fluid coming through the needle. So it's a conical tipped needle and it's called a filiform needle. And I actually looked it up. So filiform means it's like a string. It's so thin, it's thinner than a human hair. It's like surgical stainless steel. It's sterile. It is the same needle that's used in acupuncture. So we use the same needles all the way through. Um, there are sometimes physical therapy, dry needling is called Western acupuncture. Um, and then so we use it specifically for, and what I'm certified, and actually state of Maryland, it's funny, state of Maryland and New York are some of the most stringent for, rights and things to do in physical therapy. And actually Maryland, I have to be registered and meet all these criteria. So beyond just being certified, so I hold a certification, but you also have to be registered with the state to perform dry needling. Uh, so I guess the big difference, in how we use it for physical therapy is to primarily address two things: muscle trigger points, and the other main one is scars. So, and there's a lot of really good research about scars and any kind of treatment that might make your tissues more restrictive. And if I can go off a tangent a little bit,
Please.
why? Yeah, sorry. The whole reason, about a decade ago that I got involved in dry needling, I've had two ankle surgeries. Broke my ankle really bad when I was 17, ended my sports career, or what I thought might have been a sports career. Uh, so they had to cut through, put a plate in there, put screws in. I had some pain, but things, when I was 17, so I recovered quickly. Uh, a decade later, I re-broke everything. I had to get everything taken out, and then I developed a lot of scar tissue. Like in the incision, they reused that incision, the original spot, and they cut straight through the same thing. And I also had damage to like my peroneal fibularis tendon. So they went in and I healed up from surgery, but I just had pain. I couldn't run more than a mile. So I did my own therapy. I massaged it, I stretched it, cupped it, anything I could think of. I bladed it, whatever. And at the time, I didn't do dry needling. So my business partner says, hey, we've tried everything. Why don't you try some dry needling? And I remember thinking, like, it's not going to work, but what do I got to lose? So I went to a therapist, and the first time there were about 20 needles in my leg. So and in that methodology, we use the same needles, but you put the needle in, insert, and then rotate the needle about 10 to 20 times. And for whatever reason, the human body responds to that. The fascia binds around the needle, and you leave the needle in place for about 8 minutes. And after the 8 minutes, the fascia releases. So, and I remember the experience because so after about 8 minutes, they take all the needles out, and it was sore during that first time. And then I get up from the table, and the whole table was just wet with my sweat, like the whole table. Um, and I think part of what happened was that, when you have an injury for years, and that thing was hurting me for years, I couldn't really use it anymore. There was screws loose in there. So, it was kind of developed into chronic pain. So, your body goes in that fight or flight versus the parasympathetic reaction. Maybe in the Eastern medicine, they call it yin versus yang. There's a balance to the body. So I think my system was really, really flared up. And then after that time, I was really sweaty, like, my fight or flight was activated. But after like the third time they did it, I was fine. And within 2 years, I did a full marathon, 26 miles, and I had equal pain on both sides, but not related to the surgery pain. So, you know, once I did that, I got that treatment. I was like, I have to learn this and give this to my patients because it's just an amazing uh, modality to treat. Yeah. So I like it for scars. That's how I got into it. There's a ton of people with post-surgical scars that we are able to help, that have never had help before. Because, like me, I tried everything, but had never done that avenue. So, that's kind of how I got into it. And I think we were talking about the two main uses, right? The two main uses are, yeah.
Yep.
So I use it mainly for scar, but also for trigger point muscle pain.
Yeah.
So, and that's kind of, I probably do more trigger point muscle pain work than I do scar work because there's just a ton of trigger point. Like everybody's got those tight shoulders from typing on the computer, and you know, or they say I hold my stress in my shoulders. There's always a spot in my back that's tight. Uh, and everybody knows what a trigger point is because when you go to the massage therapist and the massage therapist is working on your back, and then they're like, oh, oh, look at this. They found something, and they start digging in, and it's really painful, and it takes about 5-10 minutes, but then it releases that area, and then you get up from the massage table and you feel great. You know, so the thing I love about dry needling is we are addressing those trigger point areas in the muscle, and I can do 5 minutes of massage work in 10 seconds of needle work
Hmm.
and go, and it's just I tell people it's very efficient, because people are hurting. It's stressful to be in pain, and your body does not like being in pain. So, the sooner we can get people out of pain, you know, it's great. People love it. Um, it really helps loosen things up. Uh, and you go to massage therapy and they say, oh, drink water, right? Because that helps flush out the toxins. So there's actually really good research now that when you alleviate the trigger points, you're restoring the kind of post-capillary blood flow, which was previously not moving. So there was some restrictions in blood flow. You're also you're restoring the pH. So the pH of a trigger point, the NIH did a really cool study on this. They invented something that was microscopic and they could put it in there, do the trigger point, release the trigger point, the pH restores back to like a normal balance.
Hmm.
So it was previously acidic, like a 5, and then it balances out to a 7 again. So
Wow.
it really does flush those things out. Uh, you feel sore after the treatment for like 6 hours. I tell everybody this. Some people say, I didn't feel anything. I felt great. And but I know now I've been doing it so long, I know like, I start to feel the muscle. I think the muscle I do the most is probably the traps and the back muscles. Because those are, neck and back pain, kind of the big things.
Hmm.
So we do a lot of, and it's just really efficient, as a team. Like if another therapist says, hey Tim, this guy's really bad, can you do a couple needles on him, and we'll set it up that way that, we can work as a team and really help the people get better faster.
I love
Um,
that. I actually learned something today. I had no idea it restores pH. I gotta read that now. I want to check that article out. That's amazing. I had no idea. I don't think that information was out when I was in school learning about dry needling, if it was more recent study. So that's actually a really cool finding to talk to people about. And then it also kind of, fluid, energy, right? Like we always talk about what's the Western concepts and what are the Eastern concepts behind this whole thing. And
right.
the way that I have so many friends who are, acupuncturists or, on the Eastern medicine side, even just being from the East myself, we have a lot of cultural stuff that we do and stuff that I incorporate in my brain, in my practice, not even directly, but just in a kind of more of like an affective sense. And I always say there's so much stuff that's there in Eastern medicine that we kind of just they've been doing it for like thousands and thousands and thousands of years, but it's just when we put a Western wording and Western twist on it, and then we do this research, and then it just makes more sense. And then it's now, part of Western medicine too. And I think that that's the cool part, where a lot of this stuff is actually so similar. Maybe not all, maybe some of it people still feel like is very, very, very different, but I feel like there's a general sense of similarity. And I think that actually, what you just said with the yin and the yang and the parasympathetic, sympathetic nervous system, there is so much that kind of echoes on both ends, which is really cool. I wanted to ask you next about, because as both of us, as being PTs, we love talking about movement, and we love talking about, just generally like long-term health and healing. How do you describe and educate to your patients when you're explaining the effects of dry needling and what you're doing to them versus what they need to do in their home exercise program or lifestyle factors and changes to help actually, really bring a holistic picture into this? How do you navigate that conversation with them?
Uh, Excellent question. And I would say like it really, I guess it depends on why I'm doing it. I guess the other thing I kind of forgot to mention. So it's used for scars. It's used for muscles. There's also another technique now called periosteal pecking, or with the classic my elbow tendonitis, right? Your tennis elbow. So there's always been these issues with tennis elbow. They're kind of hard to treat, right? Because it takes a long time to get a tendonitis, and then it doesn't seem to want to go away real quick. So, one of the valid treatments is like cross friction massage. I'm sure you do that for those. And you're basically beating up the tendon and you're creating inflammation so that blood flow can get in. So, one of the things I also do is periosteopecking, which is taking the needle at the origin of the muscle where it's meeting the bone, and basically putting microscopic holes in it the same way that cross friction gets blood flow to the tendon and allows it to heal itself. So that's another reason. Um, so I guess like what was your question again? So what was the purpose of the?
Yeah, I guess what I'm trying to ask you is, how do you educate your patients on how dry needling is used as an adjunct to treatment and all of the other kinds of modalities that you're using, or other forms of treatment like Therex and manual and all the other things?
Oh yeah, for sure. So yeah, so the manual it's all geared towards the same thing, which is helping the patient. So if it's a muscle issue, we're geared towards the muscle, reducing the muscle spasms. The trigger point dry needling is great for like neck and thoracic pain. Thoracic, like mid back, it's really difficult to treat because there's a bunch of ribs there. It doesn't want to move very much. So it seems like it takes a lot to get the pain in there. So, how many times you treated a thoracic back pain and you're massaging it, you're mobilizing it. So those things are all connected together. Um, I do tell people, if you have arthritis of your knee, this is not going to cure your knee arthritis. Um, there is actually studies. There's another way we use it is to work on knee arthritis. There's a study of 4 or 5 years old now. Um, you do dry needling, and it goes actually right to the bone, and you got to hook it to electrical stim, which is another methodology for. I wouldn't say that's completely understood why it works, but it's valid that it does work. So, and there's a specific methodology for that too. So I also do it for those. So it depends on what body part we're doing, but it's one part of that. Uh, the really good care that is physical therapy for different body injuries. So
Yeah.
there's defined injury, there's defined methodology to take care of people with knee pain due to knee arthritis. There's very established, like here are the exercises. You also have to do manual therapy, which addresses the body part above, the body part below. And then dry needling seems to fit in as it just helps things a little bit more. So
Mhm.
in that case, it can be just another adjunct. And then for back pain, that's not, I think for back pain that's not resolving very quickly. I think it's great to kind of jumpstart the whole healing process. So I explain to patients that exercise are part of that. Dry needling for back pain is meant to, and neck pain as well, is meant to get you out of pain and reduce the muscle spasms. Um, And as your body is healing, the joints are less inflamed. You start to feel better, and then the exercise part is the thing that keeps the back pain and neck pain from coming back. And or if there was no injury, it keeps it from returning all the time, or that nagging thing that's always in your back that you're like, man, I wish this didn't hurt every 6 months or something. So
Yeah.
yeah, I would say it's more like as an acute thing, for back pain. Um, it really fits in nicely there. Um, you know, People with tendonitis, like I got a guy right now, he plays tennis and he actually has tennis elbow, which is, it's not normally the case anymore, right? People get tendonitis from all kind of different stuff, but so uh, and people who are still playing their sport, they're not going to stop, and we don't want people to stop moving. This is what this guy loves. Maybe it's golf, maybe it's tennis, maybe it's you just like playing on the computer, and you can't do it because of pain. So you know people are motivated to get out of that pain, and it seems to be a really nice, efficient way to get that under control.
Yeah. I love how you're just talking about how it's like a part of this bigger puzzle of like all the things that we can use. And especially for people who have never heard of it. I mean, there are, like we touched on in the beginning of the episode, there are states that allow dry needling. There are states that do not allow dry needling for various reasons, particularly our acupuncturist friends who like to keep professions separated a little bit. So, you can definitely look into, if physical therapists and for people who are listening, if you're interested, check into your state to see if that's something that's offered with PT. I remember, I mean, the short period of span that I actually did dry needling, I really enjoyed doing it as a PT because it was just really fun. It was cool to see the immediate reaction, just kind of like what you said, 10 minutes of manual therapy and like a fraction of that time with dry needling. So there is
Yeah.
a really cool immediate relief that people see. But again, short term, because sometimes if people are going straight back into those same musculoskeletal habits and,
Mhm.
punching over and doing all the things, they're going to redevelop those trigger points. So it was really cool to see people get the treatment, re-educate with the exercise, re-educate with the stretching, just like you said, help build the short-term and long-term changes, and then educate them through that whole process of what we're doing. um, and then of course it's just very like anatomy focused, so that was always fun to like do something that's like you just have to be really on your toes with where your anatomy is and keep up with that. So my next question for you, Tim, on the whole dry needling concept, are there like specific, in your experience, the years that you've done dry needling, in your experience, are there certain parts of the body or certain diagnoses that you've seen that it's been the most effective for than compared to others? Like what are like the top, I guess, like two things that you found that if dry needling is done there versus not? I mean, I know this is not an RCT, but in your experience, what do you feel like it's the most effective for?
Yeah, so that's a really great question. I mean, I think I use it all the time for the neck, because people are just so tense in their necks,
Yeah.
you know, uh, and and you say like, why, you're using your trapezius, your kicks in just a little bit when you're doing a lot of people are working on a computer, right? So it can be people working on a computer, it could be, people who are, doing more physical work. It's both, they both get a lot of trigger points, and a lot of people doing levator scapula and upper trapezius. So those are like really common spots to get it. So I think it works really efficiently there and really well. It's extremely safe there. So it's a nice muscle to do. Um, and the theory on that one is they call it the Cinderella hypothesis, for
Hmm.
why it's because it's not the whole muscle. The whole muscle isn't in spasm. You're not sitting there like this. Just when you go to massage, it's really sore, it's painful, and the trigger points develop inside the muscle. Um, and they think that they call it the Cinderella hypothesis, that when you work with a mouse or when you do light activities, it doesn't you're not recruiting the whole trapezius. The body's smart. It says, well, if I recruit the whole trapezius, that costs me more energy. So I'll only recruit just a piece of that muscle, And so just a little bit of that muscle. But the Cinderella muscle that's being recruited, it's getting used and used. And it never really kicks in the rest of them.
Mm.
So it's Cinderella because she's the one who she had to do all the work and the sisters were lazy. So, so she was
Got it.
constantly working. She worked before the sisters and she didn't stop till later. So, that's where the trigger point in that develops. And it seems to be really, really common, ubiquitous almost across the board. And it responds really, really well.
I love that.
Um, the thoracic spine, it's kind of notorious. People have that kyphosis. They're sitting a lot, and it's hard to treat because because it's attached to ribs. You can't get the joints to move as easily as you can for the lumbar spine. Um, so I find it's really helpful there. I personally get dry needling in my middle back because that's a spot for me.
Yeah.
Um, and it's another really efficient way. I'd love to get it done there. Um, hips. So the trigger point pattern. So that's another thing. So if you have that pseudo sciatica patient, and I don't know, like, so I've been doing this for almost 20 years, and I don't know if you remember, like when you started training like 20 years ago, there was hip bursitis, and all the
Mhm.
orthopedists, pretty much there was this whole thing. Like if it was pain and it was not arthritis and it was lateral hip pain, it was bursitis. And if you remember, like it was weird. It was like some hip bursitis, it would take like 3 weeks, the patient would be better. And then some people with hip bursitis, it'd be like 3 months. You're like, why are you not better yet? You're still having that pain. And so oddly enough, right? So the glute minimus, which is really just a small muscle, but dense. So that muscle, a trigger point that lasts in there. If you look at the trigger point charts for that, it actually refers pain down the side of the leg, very similar to sciatica. So in cases where you see like pseudosciatica or you see lateral hip pain, the dry needling is really effective for the glute minimus and medius.
Hmm.
It's very safe there. There's no, the sciatic nerve is sort of 6 inches away. There's no major blood flow. So, it's very safe technique. And like for runners, I've had it done. I was having pseudosciatica many times from all the running. And I had a trigger point done with a needle in that spot. It literally ran down my leg and released. And it was amazing. Yeah.
Wow.
So that's a cool spot to do as well. Um, like quadratus lumborum for back pain. That is a very hard muscle to release
Yep.
manually. It can be stubborn. It can take many, many treatments. You can actually do the QL muscle with a dry needle. It takes a bigger needle, but it's actually, and those more dense and tight muscles that are deeper like that, they are, people love that when they can finally stretch out their back again.
I
Uh,
would personally love a trigger point in my quadratus lumborum right now.
yeah,
I'll fly you over.
I know. Yeah, I haven't spent much time in New York, but that seems like I've been there like 2 times in my life. It's great though.
Yeah, yeah. No, I totally hear what you're saying about that, especially the lower quarter stuff. It's funny that you were talking about the pseudo sciatica. I know exactly why you used pseudo before that. I had a patient walk in the other day. I think it was just earlier this week, and um, I think what was the wording that they used? I was like, that's not quite right. You can't actually say that. They said it hurts in my sciatica or something that was just like not.
Uh-huh.
It hurt. I think that's what they said. They're like, it hurts in my sciatica. I was like, that's not right. We can't say that. And I had to describe to them what the sciatic nerve was and where it was located. And this is the nature of pain and, movement-based things that tell, and she was like, oh yeah, no, it doesn't hurt when I said, no, it doesn't radiate down my leg. No, it doesn't, blah, blah, blah. She said no to every question that would clue me in that it could have possibly even been sciatica, true sciatica,
Right,
before I
right.
even did a straight leg raise or a slump test. And I was like, no, that's just sounds more like muscular spasm around the lower back. She was like,
Mhm.
oh, okay. So I think it's just for audience, it's sometimes common terminology to use words like sciatica, but it's also important to know what that means. And also don't label yourself. because then you feel stuck, like, oh, I have a herniated disc, I have a bulge. And then it's like you walk around being like, hi, my name is Sneha, I have a bulge in my disc. Like it's like, okay, like you can't identify yourself as a diagnosis that was maybe given to you a million years ago and probably incorrectly without even imaging done and not even that the imaging is always correct and blah blah blah. So that's a whole nother conversation.
Right.
But yes, QL, great spot I'm sure, for dry needling. That's what we were.
Oh, yeah, and it's, I'm sure you've manually released it plenty of times. It's sore. It is uncomfortable for the patient to release.
It is, but it feels
And you gotta, like,
great
oh, yeah. You
once
gotta,
it's
like,
done.
talk them through it. You're like, "This is gonna hurt. Here we go. Just
Hmm.
another minute," right?
Yeah.
Yeah.
I love it. So many great spots. I mean, for me, because I can't actually do that at my office in my clinic here in Manhattan, I haven't been able to use that modality, and I always just refer out to acupuncturist that's right next door. But such great things we can accomplish with physical therapy and our profession in the state that we're allowed to do things in, at least. I'm curious for listeners who are like, this is really cool. How do I find out if I can find a practitioner who can treat me with dry needling? Is there like I know you said you were like registered with the state of Maryland to do, is there
Mhm.
somewhere where people can actually find that information?
Um, so I don't know if it's so obviously, yeah, you can go to the Maryland Board of Health Practitioners. So if you're in
Hmm.
Maryland, so the my certification is CMTPT. So the Myopain Institute, if you're in a different state, you can go to Myopain Institute, uh, probably .com or search it on Google. And they do have a registry of all the people that have completed their courses. Um, and they're a really amazing group. I give them all the credit, so I appreciate my success in helping people, but I'm really standing on their shoulders, all the research and work that they've done. It all actually goes back to Janet Travell. She was the original doctor who came up with all the trigger points. Her only patient was John F. Kennedy for about 8 years. She was the White
Hmm.
House doc. So she was a medical doctor, and she kind of created trigger point charts and helped John F. Kennedy with his back pain. But yeah, I think you can go to My Pain Institute and search practitioners who are in your state or area, um, for sure.
Great.
And there's, and that's not the only institute that certifies its people too. So there's a couple other out there, um, which I'm just not as familiar with because I really like the one that I went to. But yeah, and they do amazing stuff. There's the My Pain Institute. They're doing things for male and female pelvic health, which I'm not certified in that. But obviously, there's plenty of people that have a lot of pain in those areas, and it can be
Mhm.
just as efficient for what I do, treating backs and knees and necks all day. There's people that are doing that. So if you're looking for help in that area too.
That's
Uh,
wonderful. And how do people find your practice? What is the website that for your company?
hmm So I was saying, so it's physical, but it's spelled FYZICAL. So you can go to just Google search for physical, and you can find me at Physical Frederick, um,
Perfect.
or Physical Germantown, and that'll link to, you could make an appointment there or email me. And my email is tim.garrison@physical.com. So I
Perfect.
can also reach there.
Amazing. And I'll drop that stuff into our show notes as well. So folks can get in touch with you if they want to work with you, if they have questions and want to learn more about what you're doing out there in Maryland. Dr. Garrison, this was amazing. Thank you so much
Oh,
for spending time with us here and educating us and refreshing my memory and all the dry needling things. Thank you so much.
oh, thank you. And thank you for what you do for everybody and hosting this podcast. I appreciate it.